So what now? What does our future look like? Well, one thing I know for sure is that we have a lot of explaining to do. No, I'm not a physical therapist. No, I can't help you find a job. I will not give you therapy because you're crazy. No, I don't just work with old people. No, I don't just sit around and play with kids all day. Yes, I will get you back doing the things that you love. Yes, I will consider what you like to do and use it during your therapy session. Yes, I will work with everyone around you to get you as independent as possible during your daily activities. Yes, I will show you tools and tricks that will make daily activities easier for you to do on your own. So today is a day of transition, a time for change, excitement, a little stress about studying for our boards, and also uncomfortable feelings about, once again, we embark on something new, our careers. As our formal education comes to an end, we know that we will always be reflective and lifelong learners. We will continue to learn and grow in our professional and in our personal lives. We realize that we don't know everything there is to know about doing our job. But as my amazing clinical instructor told me recently, it's okay to not know everything. Use common sense, research it out, ask questions, watch your colleagues, and also learn from our patients. They have a lot of great ideas that we could pass along to other patients that we work with. And most importantly, be confident in applying it. We know it, or we know how to find out. This program has stripped us down to the core. So much so that Richard Simmons even came out of me multiple times. We have discovered our weaknesses and our strengths. It has built us up to who we are today. We are a different people than that day in orientation during the summer before we began the program sitting there. We are different now. And that is because of our experiences at school and at field work. Some of us were very determined, like, I want to work with children, I want to work with older people. We had our set of demographics that we were going to be specialists over. But throughout our experiences, some of that has changed for us. And now we have new passions and new group of people that we want to work with. And I think about the wife in the hospital who her husband just had a stroke, and she's concerned about how she's going to get him out of bed when he comes back home, and what's going to happen when she goes back to work, and how's he going to manage without her while she has to work. I think about the 5-year-old boy that comes to school in pajamas and dress shoes, and he has his hands just clamped over his ears because he just can't handle the loud noise all the time. I think about the 92-year-old man who had one leg amputated up to the knee and then the foot on his other leg just amputated. And he's sitting in inpatient rehab, and he is feeling agitated and expresses frustration and hopelessness, and that he just wants to stay in bed for the rest of his life. He's 92. I think about that cute older couple that's been married for 72 years, living in their home, and they're trying to decide what to do because the wife has dementia and she's had multiple falls lately, and they're trying to decide whether to put her in a nursing home. An OT named Rachel Tibute said this: I am an occupational therapist, an obscure profession if there ever was one. We are far and few between, maybe because we have chosen to serve people with disabilities, all disabilities, not a glamorous endeavor, not a lucrative one. And I say serve because when we deem that in helping is that we see weakness, while serving, we see wholeness. We don't fix people. You see, with them, we simply try to find a meaning, a balance, and justice. I chose occupational therapy because it blends science and humanitarianism, intellectual rigor, and compassion. What an awesome opportunity it is for us to use our knowledge, skill, our personalities, and most importantly, our hearts to serve our neighbors, our community. We will educate the wife in the hospital on appropriate equipment and techniques to safely get her husband out of bed and construct a routine that will work in their household to help him be as independent as possible while she's at work. We will hug our little 5-year-old friend and help him to acclimate to school and to cope with his sensitivities to sound. We will be creative and fun in doing this. We will comfort our cranky 92-year-old with humor and a positive attitude, but not overly then, not disregarding his feelings, but just enough that it shows compassion to combat his feelings of hopelessness and shows the real desire that we have in helping him have a quality of life that he deserves. We will educate the cute little couple on their options, point out what they do have going for them, and the possibilities, opening their minds, the possibilities of making minor changes in their home and eliciting help. Let's be the therapist that these people need. I often think about how I would feel if I was in that situation, if that happened to me, and that's helped me to develop into the therapist that I want to be. I think of everyone in this graduating class, and my heart warms to know that we are very hardworking and compassionate people. We are ready for this. We are ready to serve our communities with all that we have, and as Heidi often says, you've got this.